Hi, my name is Dr. Robert Fiala. I'm a chiropractor. I practice in Woodbridge, New Jersey. I specialize in functional nutrition and functional neurology. Today I wanted to speak to you about a problem I'm seeing a lot, which is thyroid issues, hypothyroid to be specific. People have been coming in and people have been getting diagnosed more and more with underfunctioning thyroid glands, and a lot of people are dissatisfied with the results they're seeing with their treatment because even though they're on thyroid medication, they still don't feel that the situation is handled. They still have the symptoms of having an underfunctioning thyroid when their blood tests are all normal. So thyroid gland, just in brief, is a gland which is located over here in the throat, front part of the throat, and it releases chemicals that set the body's metabolism. It's very intimately tied in with the functioning of your immune system. It has a lot to do with your overall health. People who have underfunctioning thyroids typically are fatigued. They find it difficult to lose weight. They have dry skin, brittle hair. They also get things like a brain fog. I see a lot of patients with fibromyalgia. They have typically this brain fog, and they may be depressed. Now, it's a very interesting thing that people these days are on so many antidepressants, but yet they've never had a real full, thorough evaluation of their thyroid function, and lowered thyroid function can lead to something like clinical depression. So if it's not been checked for, and if you're one of those people with hypothyroid or fibromyalgia or depression, you might want to take a look at that. Now, when you go to your doctor, typically they check one chemical level on a thyroid test, and that is a chemical called TSH. That's released by the pituitary gland, a gland in the brain, then sets the stage for the thyroid to produce its chemicals, which then regulate the body's metabolism. Alright, just testing TSH is really not sufficient to determine what's going on. I use a full panel of thyroid chemical analysis. It's usually 7 different tests to determine all the different chemistry levels of the thyroid, and then from there determine which one is going on. There are different categories of thyroid problems. Only one of those responds to thyroid hormone. So it's no surprise that you've been diagnosed with some sort of a hypothyroid issue, yet you've been put on medication and you still feel the same, even though your doctor looks at your lab work and says, hey, everything is fine, it's going really great. Well, what you need is a much more thorough evaluation and a thorough set of blood chemistries taken. Then we can determine what's going on with you for real and get you back on the path to restoring your health through this. This may tie in, just to tell you, if you do go down this road, there may be dietary changes, lifestyle changes heading your way. You may have to give up things like gluten. It really depends on what's going on with you, but I do take each case on an individual basis, or if you're whoever you go to as your healthcare practitioner, they should actually do a full, thorough thyroid testing and evaluation on you, and then find out what's going on and put you on the right course for some treatment. My name and numbers are available here. You can go to my website, which is woodbridgepainrelief.com, and read more about these topics. And I want to thank you for watching. I hope you got something valuable out of this, and thank you very much.